Hello everyone and welcome back to our reproductive male hormones. The second topic in our section will be anti-androgen or anti-androgen. As you can see here from this graph, we have two types of anti-androgen. We need to remember this type of anti-androgen according to the mechanism of action. We have a group of medication that inhibit 5-alpha reductase. As you can see it here, I will go back to the previous slide. So we have a group of medication that inhibit enzyme called 5-alpha reductase, considered like anti-androgen. Two medication, finasteride, dutasteride. This medication inhibit the 5-alpha reductase, decrease formation of dihydrotestosterone. This medication used for patients suffer from benign prostatic hypertrophy or hyperplasia. So please remember the 5-alpha reductase inhibitor enzyme. This will lead to the 5-alpha reductase inhibitors, so we can type minus here, inhibit this enzyme. This will lead to the decreased formation of dihydrotestosterone. For this reason, we use it for patients from benign prostatic hyperplasia. This is maybe the first type of, or the first group of medication, 5-alpha reductase inhibitor. The second group, we have a medication that block the estrogen receptor. Normally, we don't use a medication to block the estrogen testosterone receptor, such as Flutamide, Bicalutamide, and Flutamide. So you can see here that these medication, Flutamide, Bicalutamide, we have a new group of medication. This is block the androgen receptor. So we have the androgen receptor. This medication block the androgen receptor. Consider blockers. So block the receptor. Here we have severe case because we need androgen to be available in male. But in some rare case like cancer treatment, prostate cancer treatment, we need to block all the androgen receptor in male body to prevent the growth of cancer or to treat cancer. So we have Flutamide, Bicalutamide, and so on. And this group of medication effective for the treatment or orally for the treatment of prostate cancer. So I would like to bring like article published in the Frontier about the second generation of anti-androgen from discovery to standard of care in castration in patient with the resistance prostate cancer. You have it here. It's published in the United States. You can see it here. If you scroll down, you have the image here. If you click on the image, they will take you to this image here. So you can see here 5-alpha reductase. This enzyme prevent the conversion of testosterone to the dihydrotestosterone, and we know that dihydrotestosterone bind to the androgen receptor. Okay, we have a Flutamide or a Flutamide binding to the receptor and prevent dihydrotestosterone to bind to the receptor. So you can see what we have there. We have two groups of medication. The first group will be work on the enzyme and used for benign prostatic hypertrophy. We have finasteride, dutasteride. So what is finasteride, dutasteride? Finasteride, dutasteride is like enzyme inhibitor, inhibit 5-alpha reductase, prevent formation of dihydrotestosterone. Finasteride, dutasteride used to treat patients suffer from benign prostatic hyperplasia. Done. What is our second section here? We have androgen competitive and androgen receptor blocker, competitive receptor blocker, androgen receptor blocker. We have Flutamide, Nilotamide, and you can see tamide, the suffix tamide. And this medication block the androgen receptor, and this medication used for prostate cancer. Okay, another anti-androgen. So the first group inhibit the enzyme 5-alpha reductase. The second group will be the Flutamide and prostate cancer. Then we have ketoconazole. Ketoconazole, we all know that ketoconazole considered like antifungal medication. Ketoconazole also has an anti-androgenic activity, ketoconazole. So we have ketoconazole as anti-androgen. We have spironolactone, then we have cyproterone. So the first one, ketoconazole, considered like antifungal. Ketoconazole could be used for treatment of hirsutism in women. We use it for the precocious puberty in boys. and we can use that with the ketoconazole for rapid reduction in testosterone level. Spironolactone, we know that spironolactone belongs to the diuretic medication, but spironolactone also has anti-androgenic effect. Spironolactone also could be used for patients, for women suffer from hirsutism. On the other hand, we have cyproterone. Cyproterone is like androgen, anti-androgen, used for hirsutism in women, decreased sexual desire in men. So we have three other anti-androgen: ketoconazole, spironolactone, and cyproterone. Ketoconazole antifungal, spironolactone diuretic, cyproterone anti-androgen. Okay, so a little bit of information about the cyproterone acetate. This is synthetic steroid, anti-androgenic effect, and progestogenic properties. Here we have different approach. When you use different doses, we use it for different indication. So we use, for example, 2 milligram cyproterone in combination with ethinyl estradiol. This one we use it as oral contraceptive pill, and this is very useful in for example, to prevent pregnancy and for women suffer from acne or hirsutism. Hirsutism means excessive hair growth, for example. Okay, so we use medium dose like 50 milligrams, then we use high dose as 100, 300 milligram. We go from there, and you can see here we have cyproterone as a medium dose. We use it for polycystic ovary syndrome here, and I will go to the next slide to show you what we have here. So you can see number one, low dose 2 milligram in combination with the ethinyl estradiol 35 microgram. Then we have medium dose 50 milligram cyproterone. We are talking about cyproterone here. We have 50 milligram. Then we have high dose of cyproterone 300, 100, 300. What happened there? The first case low dose, we use it in female as oral contraceptive, as a treatment for acne, as treatment for hirsutism. The second dose, 50 milligram, medium dose, we use it in female who suffer from severe hirsutism, severe acne, and polycystic ovary syndrome. We use high dose, number three, we use high dose 300, 100, 300 milligram cyproterone. This is a higher dose used for prostate cancer, anti-androgen, and to decrease sexual drive and decrease hypersexuality. So you can see here with when we change the dose, we change the indication. Low dose contraceptive, medium dose hirsutism, acne, PCOS. Then we have higher dose for prostate cancer and decreased hypersexuality. Okay, this concludes our brief discussion about anti-androgen. We discussed 5-alpha reductase inhibitor. We discussed androgen receptor blockers. We have Flutamide, Bicalutamide, Nilotinib. Then we discussed other androgens such as ketoconazole, spironolactone, and cyproterone. This is briefly, maybe brief discussion about the anti-androgen. So the next lecture, maybe section, we are going to speak about the prostate, benign prostatic hyperplasia. Thank you so much for watching, and have a great day.